Bismillahirrahmanirrahim. I am Dr. Avais Shuja from Department of Surgery. Today, this is the first online lecture for final year for the subject of surgery. The topic today is gallstone disease or cholelithiasis. This is an important surgical topic which is a common disease in our country. The outline of today's talk is that we will discuss about the definition of gallstones, the types of gallstones, formation of gallstones, clinical features, diagnosis, and management of gallstones. Gallstones, by definition, are presence of stones in the gallbladder. Gallbladder is a part of a biliary tract. It is a muscular sac present at the undersurface of the liver, and when stones are present in it, these are called gallstones or cholelithiasis. uh, the epidemiology of gallstones, which means how the pattern of gallstones or cholelithiasis is. There are 10 to 15% of people in the population who will have gallstones in their lifetime. Out of this population, for every one male, there are two females which are affected by it. So we can say that it is a disease more common in females, and more than 80% of these patients are asymptomatic. They do not have any symptoms, but they are diagnosed incidentally when they have an ultrasound scan for another reason. Most commonly, it is present in a Pima tribe of the Arizona of USA, which have more than 70% of population suffering from cholelithiasis. The types of gallstones, there are three types of gallstones: cholesterol stones, black pigment stones, and brown pigment stones. These three are different types which are caused by different reasons, and they have different chemical structures. The cholesterol stone, they are mostly most common cause or most common type in the Western world, and they are not associated when with any infected bile, and they are often multiple and medium sized, and they are yellow green in color, and they are usually due to the increased cholesterol in the body. Black pigment stones, they are most common in Asian population. They are associated with infection. They are usually multiple, small, irregular, dark green to black in color, and they are oftenly associated with infection. The other are the brown pigment stones. They are usually formed in bile ducts, and they are most commonly due to infection in the bile ducts or biliary tract. Now, formation of gallstones, how these stones are formed. For this, we need to understand the uh, function of the gallbladder, which will eventually we will be able to describe the cause of gallstones. What is the function of the gallbladder? That all the fatty fluid comes into the stomach, and then it goes in the duodenum, and that stimulates the gallbladder to push the bile into the duodenum, and this bile helps to in the absorption of the fat by forming micelles, which are circular mm, form things in which the cholesterol is the center, and it is surrounded by phospholipids and bile salts. These are called micelles. These help in the absorption of the cholesterol into the bloodstream. And now, this is as I explained that in bile there is 70% bile acids, 10% cholesterol, 5% phospholipids, and other things. This is commonly, which I explained, the micelles. that you can see here in the center there is cholesterol surrounded by bile salts and proteins, which are, this is a micelle formation in which cholesterol and bile acids are in a balance. You can see here, which I explained, the micelles, a circular structure, and cholesterol in the center. Here, uh, from the first cause or important cause of gallstone formation is supersaturation of cholesterol, where the cholesterol amount of cholesterol is quite high and more than the bile salts and bile acids can handle or make missiles from them, so their cholesterol lying freely, which precipitates and forms cholesterol gallstones. And in other causes can be there is the bile salts are not enough, so in that case again the cholesterol will be normal but the bile salts are less, and that happens when there is loss of bile salts through the intestine, when there is loss of absorptive surface of the small intestine, and then can lead to stone formation, which will be bilirubin stones. These stones are not visible on X-ray because they have less amount of calcium as compared to the stones in other tracts like renal tract. And another cause of gallstone formation is gallbladder stasis, which leads to precipitation of cholesterol, which will lead to cholesterol stone formation. To summarize, gallstones are formed by supersaturated bile by cholesterol, which happens in obese patients and patients who are taking estrogens or oral contraceptive pills, and when there is decreased bile salts and acids, and sometimes there are cholesterol nucleating factors in abundance which cause cholesterol stone. Clinical presentation of gallstones, the most important or common sign and symptom is right upper quadrant pain, and it can be associated with dyspepsia, flatulence, nausea, and on examination Murphy's sign is positive, fever and tachycardia can be there. Murphy's sign is when the hand is placed in the epigastrium, the and patient takes a deep breath, the diaphragm lowers and hits the inflamed gallbladder and the patient catches a breath, or simply it can be described as tenderness in the right upper quadrant. This is called Murphy's sign. There's usually three common clinical syndromes due to gallstone. First is biliary colic, which has, in this the patients have right upper quadrant pain, which settles down after some time, and other is acute cholecystitis, in which there is continuous right upper quadrant pain associated with fever and raised white cell count, and lastly cholangitis, in which right upper quadrant pain, fever, WBC count, and jaundice is present also. So whenever we evaluate a patient with cholelithiasis, we have to assess the patient and decide in which of the syndromes is present, either biliary colic, acute cholecystitis, or cholangitis. Though what complications can happen, the stones can lead to in the gallbladder, can cause acute cholecystitis, chronic cholecystitis, or sometimes the stone can block the Hartmann's pouch and lead to a mucocele. If mucocele persists, it can become infected and can cause empyema. The pathological process happens when there is increased obstruction of the bile outflow, the intraluminal pressure in the gallbladder increases, and there is edema of the gallbladder wall, and if it persists it eventually leads to gallbladder distension and ischemia of the wall of the gallbladder, which would subsequently become gangrenous and perforate and lead to serious consequences. Diagnosis: the gold standard investigation is transabdominal scan. The gallstones are identified by posterior acoustic shadow. Here you can see this is the stone and this is the posterior acoustic shadow. And on ultrasound, we should look for the number of the stones, gallbladder wall thickness, and pericholecystic collection, and to see if the stone has slipped forward into the further in the biliary tract. We have to see either the common bile duct is dilated or of normal diameter. These are the four important things we have to check in the ultrasound report. Complications of gallstones, in the gallbladder, as I mentioned, acute cholecystitis, chronic cholecystitis, and if it goes slips into the bile duct, it can cause jaundice, cholangitis, and further down it can cause pancreatitis. And if it goes into the bowel, it can cause gallstone ileus. And these are the complications which gallstones can cause. As mentioned briefly previously, that the gold standard investigation is transabdominal ultrasound. Complete blood count is essential to see any raised white cell count, and we have to check liver function test to see any evidence of obstruction or slippage of stone into the bile duct. Serum amylase will diagnose pancreatitis if it is present. Exergest in elderly patients is to rule out other pathologies which can present as right upper quadrant pain. And if not clear, CT scan abdomen can be done for if there is a palpable mass in the right upper quadrant and the patient is elderly. It's basically to rule out any malignancy. Management, for management purposes, there are two groups of patients with cholelithiasis, the asymptomatic group and symptomatic group. Asymptomatic, they do not need treatment. Symptomatic, there is only one treatment, that is cholecystectomy, which the gold standard approach is laparoscopic cholecystectomy. This is performed after initial management, but the treatment is cholecystectomy. In asymptomatic patient, no treatment is required, except there are exceptions when the patient is diabetic or suffers from hemolytic anemia or is having bariatric surgery. They have their gallbladder removed because after bariatric surgery there is a high incidence of formation of gallstones. Initial management includes patient is made nil per mouth, that is to give rest to the gallbladder. Parenteral analgesia is given, parenteral antibiotics is given, and jaundice is ruled out by doing investigations. The cholecystitis is graded in three grades, 1, 2, and 3. 1, it is simple, there is no only pain, white cell count raised, and fever. In grade 2, if white cell is more than 18,000, there is a palpable tender mass, or the symptoms have been there for more than 72 hours, then it is grade 2. Grade 3, when there is organ function, one or more of the following organs have failed to function, like cardiovascular compromise, respiratory compromise, renal compromise, and hepatic. Any of one or more will be graded 3. The patients of cholecystitis is graded to decide about the timing of surgery. In grade 1 cholecystitis, the cholecystectomy, early cholecystectomy is done, that is within the same admission. In grade 2, early can be done, and also patient can be discharged, and a delayed cholecystectomy can be done after 6 weeks. But nowadays, evidence suggests that early cholecystectomy is more favorable. In grade 3, cholecystostomy is done under local anesthesia to drain the bile and stones, and when the patient stabilizes or improves at a later date, cholecystectomy is done. This is how we can manage a patient of cholelithiasis. To summarize this, that Cholelithiasis is a disease in which stones are present in the biliary tract and gallbladder. It is more common in females, and there is a myth that the profile of a gallbladder disease patient is female, 40, fair, fat, and fertile. But this is not evidence based, this is a surgical myth. And there are three types of stone: cholesterol pigment, brown pigment, and black pigment. In our country, the pigment stones are more common, and it is the gold standard investigation is transabdominal ultrasound, and the treatment is cholecystectomy. There is no medical management for cholelithiasis. The complications are multiple, can be in the gallbladder like cholecystitis, mucocele, empyema, and in the common bile duct like obstructive jaundice, cholangitis, and in the intestine it can be small bowel obstruction due to gallstone ileus. And this is all about cholelithiasis, and we will continue with the series of these lectures. The next will be about cholelithiasis. Thank you very much. Allah Hafiz.